Dear audience, I am pleased to present my PhD topic about risk factor for pancreatic cancer and share my progress over the past 3 months. My name is Zsófia Román, and I am a nutritional scientist, and currently I'm working as a clinical research administrator at the Institute of Pancreatic Diseases, and I'm also a PhD student. Our vision is to improve the prognosis of pancreatic cancer, saving years of life lost. And to be able to do that, our mission is to explore the association between glucose metabolism alteration and the diagnosis of pancreatic cancer. To achieve those goals, I have 2 ongoing projects. In the first one, we would like to understand the association between hemoglobin A1c levels and pancreatic cancer, while my second project focuses on patient characteristics and prognosis between early and late onset pancreatic cancer. So my first project is investigating the effect of hemoglobin A1c level on the onset and risk of pancreatic cancer. Pancreatic cancer is predicted to be the second leading cause of cancer-related mortality by 2030. The expected increase in mortality rate can be due to the delayed diagnosis as the lack of predictive factor for pancreatic cancer. What is known is that type 2 diabetes mellitus is a risk factor for pancreatic cancer, where pancreatic cancer develops within 3 years from the diagnosis. However, what is not known is that dose-dependent association of hemoglobin A1c levels, which is a marker for glucose metabolism, and the risk of pancreatic cancer. Therefore, our aim in this study is to investigate the association of hemoglobin A1c levels and the risk of pancreatic cancer. Related to this topic, our clinical question is, how do different hemoglobin A1c levels influence the risk of developing pancreatic cancer? We would like to analyze in the adult population the different levels of hemoglobin A1c, and we would like to see a higher hemoglobin A1c levels increase the risk of pancreatic cancer. As for the clinical implication, understanding early onset pancreatic cancers and specifically hemoglobin A1c's role could help in the early detection and management strategies. We led a systematic search in 3 different online databases with the following search key. The first domain includes the different terms of pancreatic cancer, while the second domain focuses on hemoglobin A1c. During my search, I didn't find any meta-analysis related to this topic. This is the table which includes the 3 key articles with the different hemoglobin A1c levels, but similar outcomes, which are that a higher hemoglobin A1c levels can lead to a higher risk of developing pancreatic cancer. Here is the flowchart of the selection process. We started with nearly 9,000 articles, and after the duplicate removal, we had 7,000. Out of those, we selected 184 eligible ones. Here is the current progress of my first project. With my co-investigators, we were selecting the article by title and abstracts, and after this, we will begin the full text selection. So, my second project is comparing the patient characteristics and natural history of early and late onset pancreatic cancer. Pancreatic cancer is becoming an issue. It's still unclear which factor affects the prognosis related to age. Unlike most cancers, pancreatic cancer affects not only the older generation, but the youngest one as well. Therefore, we can categorize into 2 major groups, as early and late onset pancreatic cancer. Early onset pancreatic cancer is defined as pancreatic cancer diagnosed the age before the 50 years, and it's increasing over the recent years. It's typically driven by inherited and lifestyle factors. On the other hand, we have late onset pancreatic cancer, where typically somatic mutation drive the disease. Therefore, our aim in this study is to understand the characteristics of early onset pancreatic cancer and how it affects treatment outcomes and overall survival. To analyze this issue, our clinical question is, what are the characteristics and prognosis of pancreatic cancer associated with early onset? We would like to analyze in the adult population and compare those with early and late onset pancreatic cancer, and we would like to see the different characteristics and prognosis. As for the clinical implication, understanding early onset pancreatic cancer treatment responses could improve our guideline and potentially screening processes as well. I did a preliminary research with the following search key. The first domain is same as in my first project, while the second domain focuses on early onset. During my search, I found a systematic review related to this topic, but no meta-analysis. Here is the table which contains my 3 key articles with the different characteristics and different prognosis between early and late onset groups. To summarize, I have 2 ongoing projects, which is focusing on patient characteristics, and we would like to know that how it affects on the disease. My aim is to submit my first project by September 2025, while my second project by March 2026. At the end, I would like to quote B.B. King, "The beautiful thing about learning is that no one can take it away from you." Thank you for your attention.
I have a question regarding to your first project. So, what challenges did you face during your research?
Thank you for your question. During my preliminary research, we saw that most of the articles includes hemoglobin A1C level, but just in the baseline characteristics. So we have to be careful when we did abstract and title selection, because most of the cases, this article didn't mention hemoglobin A1C levels in the abstract. So we include most of those articles which fit on PFO and didn't mention hemoglobin A1C levels in the title and in the abstracts.
So I have a question too. It was a great presentation. I'm just wondering, you said for your second project there you find only a systematic review before your search, during your search. What do you think is the reason they did not perform a meta-analysis from it?
Yeah, it is a good question, because basically this article was published in 2022 in January, and so almost 3 years, and they modified in this year, and so their article before the first published, and based on my key articles, which from 2 is published in this year, and 1 is just before this year. So I think my meta-analysis will be feasible, and we will have eligible data for doing a meta-analysis.
Congratulations. I have one question concerning on your first project. What were the exact inclusion and exclusion criteria?
Thank you. We would like to include all adult people with measured hemoglobin A1C levels before the diagnosis. And we would like to focus on PDAC, because neuroendocrine tumor is, so this type of tumor can produce hormones as insulin, and it affects hemoglobin A1C levels.
I can see that your data is comparable to whatever out there 5 or 10 years ago. The odd ratios are the same in a type 2 or higher A1C level. The percentage of cancer incidence is the same. What new do you have through your meta-analysis to tell us that I can take this thing to any peripheral hospital and say, we may have to do it differently so we can benefit from here. Because your data is comparable. It's the same, basically. I don't see any changes. So what new do you have?
I hope that we can do prospective and retrospective analysis, and I believe that we will see the incidence rate of hemoglobin A1C levels, and maybe we can know end of our meta-analysis the dose-dependent association, and we can improve the guidelines.